First, though, we need to talk about mental health. Now, if you're struggling, imagine being sent to a hospital hundreds of miles from home because of a shortage of beds. Now, in the past, the Mental Health Trust in Kent, called the KMPT, has sent some patients as far away as places like Hull because they don't have the capacity here. Now, in recent years, they have drastically reduced inappropriate out-of-area placements, and they've told me they're trying really, really hard to make sure it doesn't happen. I caught up with Helen Greatorex, the chief executive of the trust, and she said now it is very rare, actually, that they would send patients away for treatments.
That's an absolutely last resort. So all our patients, we've given a commitment that if you need a mental health bed in the county, then we will do absolutely everything we can to find you one of our beds, a KMPT bed in the county. If we can't, because we're absolutely full, and you will know, Anna, that the pressure on services is significant.
Yes.
So sometimes we cannot find a bed, and if we can't find a KMPT bed, then it's in those instances where someone clearly needs to be admitted to hospital. Their safety is at risk. If they're not admitted, then in order to find a bed for them, we will go outside. And what we do when that happens is make sure that we keep really close contact with them and the placement that they're in, so that as fast as we can, we bring them back to one of our own beds.
And is it quite nuanced, even quite difficult for you? You're weighing up a lot of things with an individual. So you're thinking what is best for them, because for some people it might exacerbate problems if they're moved away. But for others, as you say, if it's an emergency, they need treatment now.
Oh, completely. This is all clinical decision making. This is not managers making decisions. These are our clinicians, and very carefully assessing what it is that person needs. These days, I've been working in mental health services now for 40 years, and it is an absolute last resort, quite rightly, to bring people into hospital because it's the last place anyone wants to be. So we have all sorts of fabulous services in the community that can provide an alternative to admission. So things like our crisis services, and you might have heard, and your listeners might have heard of the concept of a virtual ward, where actually you get the care and treatment for your physical health needs, but in the comfort of your own home with equipment and practitioners coming in to see you there instead of you having to come into hospital and being treated there. And we do the same for mental health. So we will visit people at home 365 days a year, 24 hours a day, 3 or 4 times if that's what it takes to keep someone safe at home and avoid them coming into hospital. So the world has changed really for absolutely the better over the past decades. And so you only come into hospital if you absolutely need to, which means that at that point, you're right, it's a very carefully, clinically assessed decision about whether someone needs an inpatient admission. And of course, once it's clear that they do, the priority is to find a KMPT bed, and if we can't, then we would go somewhere else, because the priority is that they need a bed. Well, it's disappointing to everyone. The last thing we want to do is send people out of area. When I joined the organisation back in 2016, we were one of the highest users of out-of-area beds at that point, and it was costing around £1.3 million a month.
Wow.
And even if those beds had been free, it didn't cost anything. It was so wrong, because we'd got patients in Hull, we'd got them in far-flung corners of the country, far from their friends and families.
And you were talking about the pressures that you're under. Yes, we are all aware of those. To what extent has the pandemic really affected demand? It's been so tough, hasn't it, for so many people?
Yeah, it really has. So we've seen an increase of around 10% on our activity from before the pandemic. And you're right, yes, it has been very hard. We've noticed a couple of things. One is people that we've known for a long time. So lots of our patients are with us over many years. And we've noticed our long-standing, well-known patients have had a particularly difficult time, and then are very, very unwell, so need a longer admission. And of course, that can affect the flow of patients through hospitals. And we've also noticed people who've never needed mental health services before, as a result of their experience of the pandemic, needing us, so needing to have more rapid access. So it has changed the way that we operate, and using the virtual world. One of the upsides from the pandemic that I think has really surprised and pleased lots of us in the NHS is that we're now able to work in different ways with patients and with each other, in a much more flexible way. So quite a lot of our patients really value being able to choose whether they want to see someone in person or virtually. And of course, if you're seeing someone virtually, it's likely that you're going to be able to increase the number of appointments you can offer.
Of course, times are so straitened, aren't they, for so many people? I mean, are you expecting even more demand as we head into 2023?
Yes, we are. And I think we would be foolish not to. So again, thinking how we can create opportunities and also offer different ways of doing things. So there are some fabulous third sector organisations across the county with whom we've got great relationships and opportunities to think about people who perhaps don't need specialist mental health services that we provide, but actually do need something. So, for example, having mental health workers in GP practices, that's a really good way to get support, help, advice and some signposting out there to people so that they don't need to come. Perhaps their need isn't as significant as the sorts of services that we provide, but they definitely need something and we can help signpost them to the right place.
That is then Helen Greatorex, the boss of the Mental Health Trust, KMPT, on the rising demand, also the reduction in patients being sent outside of Kent for a mental health bed. As you've heard, it's only in extremis where what would be worse is not getting treatment, if you get my drift. Now, if you or a member of your family are affected by this story, first of all, our thoughts are with you. Hope you're okay. I know it's particularly difficult, isn't it, in a cost of living crisis when it's this cold outside to be dealing with all of this. Have you been sent outside, Ken, for mental health treatment? Maybe actually you had a positive experience because actually you got the treatment that you needed, came back feeling much better. You can get in touch, 08000 321 333. Start your message with the word Kent and we'll make sure we keep mental health as a top priority, of course, here on the Wake Up Call.